Greetings and a warm welcome to all the dignitaries present here. I'm Rimpa from Clunet, serving as the allocated session assistant to ensure a seamless experience. Clunet proudly stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clunet serves as a director partner for this event hosted by IMA JDN, and the focus of today's session is Thiran. Now, I would like to invite Joel, sir, to proceed. Over to you, sir. Thank you. Sir, are you there? Yeah.
Yeah, yeah. A very pleasant evening to everyone present here. We warmly welcome you all to the second session of Thiran by IMA MSN and JDN Tirunelveli. We will start the session with the IMA prayer, but after Dashna, co-convener of IMA MSN Tirunelveli will start the session with the IMA prayer. Very pleasant evening to everyone present here. We warmly welcome you all to the second session of Thiran by IMA MSN and JDN Tirunelveli. We will start the session with the IMA prayer by Dr. Dashna, co-convener of IMA MSN Tirunelveli.
May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Next, I call upon Dr. Joel Raj, General Secretary of IMA MSN Tirunelveli, for the physician prayer.
Dear Lord, to great physician, I kneel before thee, since every good and perfect gift must come from thee. I pray. Give skill to my hands, clear vision to my mind, kindness and sympathy to my heart, give singleness of purpose, strength to life at least a part of the burden of my suffering fellow men, and a true realization of the rare privilege that is mine. Take from my heart all guilt and worldliness, that with the simple faith of a child I rely on thee. Thank you.
Next, I invite Dr. Mari Selvam, Council Member of IMA MSN Tirunelveli, for the flag salutation.
Thank you, ma'am. Flag salutation. We, the members of Indian Medical Association, stand here to salute our national flag. To its honor and glory shall be our light and strength, and its course shall be our course. We pledge our allegiance to it and realizing our responsibilities as the accredited members of this thing in our power to things. Jai Hind. Thank you, ma'am.
Next, we will invite our convener, Dr. Nandini Srijit ma'am, to give the welcome address.
Nandini. Okay.
Good evening, ma'am.
Okay. Welcome, Ahmad. Audible now?
Yes.
Okay, so welcome everyone for this second session of Thiran. So we have initiated Thiran from the last week. We had our first session on NEET PG. We had three amazing speakers to speak on NEET PG, and they gave their experience and how they prepared for NEET and how they passed the exam and got this much good rank. So here we are for the second session of Thiran. So this is about all about MRCP UK. We all have heard about MRCP UK, of course, but in detail we don't know that much in detail, and there are so many things still we don't know about MRCP UK, and we have our amazing speaker. Aravind, Aravind is our own alumni of Tirunelveli Medical College, and he has been the I and Aravind were the starters of TVMC MSN team. So I'm proud that he's my batchmate, and he's um, he is going to be the speaker for this day. So we welcome everyone for the second session of Thiran, and hope it will be very useful for everyone, and welcome all the participants who are here to utilize this session. Thank you everyone for joining, and we'll go on to the session soon. That's enough.
Thank you, ma'am. Next, we welcome our speaker for Thiran Session 2, Alumni of our college, Dr. M. Aravind sir, 2017 batch of TVMC and past chairman of MSN Tirunelveli and the youngest doctor to complete MRCP right after MBBS. We request you to take over the session, sir.
Hello. Hi. Am I audible?
Yes, sir.
Hi. Am I audible? Yeah. Thank you. Thank you for the confirmation. Hello, my dear juniors. How are you? I hope you all are doing well. I want to hear from you. How are you? You there? Hello.
We're doing fine, sir.
You're doing great. Very good. So it's actually a very exciting opportunity for me, and I'm really honored. To have this opportunity. And before starting my speech, I want to thank my fellow batchmate Srija and the MSN committee as well as the IMA JDN committee and Dr. Harigan sir and Dr. Subramanian sir for providing this opportunity. So, and I would like to say a few words about my professors. Just give me 1 minute. Yeah. So I was deeply inspired by Dr. Rajagopala Martandam and Dr. Ratna Kumar, my well-renowned professors from TVMC. And they actually guided me a lot in this journey. And I would like to say a heartfelt gratitude to them. And I dedicate all my success to my parents and my younger sister and to all my friends who have been really, very motivating and who have been a very integral part of my journey too. So let's jump into the session. So I want to know a few things about it, like how much are you aware about MRCP and stuff? Like, do anyone have any general idea about it, or else do you want me to start from the beginning? Anyone? Am I clear and audible?
Yeah, you are audible, Aravind. Yeah.
Yeah. Okay. Fine. Thank you. Thank you.
Okay. The
Let's
question
start.
actually, I'll share my idea of MRCP. So actually, I thought it was similar like USMLE and lab, and we'll be doing the exam and we'll be going to UK and do the works. But I eventually heard that it's an exam we'll go have to face it, and the pass percentage is very less, and what and all we can do with the degree, and can we utilize it? How can we utilize it in India? These and all are my doubts personally. So maybe it will be great if you start from the scratch of MRCP, because it will be useful for everyone. And many medical students have joined. So they'll start preparing if it is capable in their capacity.
Yeah, I really appreciate your enthusiasm, Sricha. So actually, let me tell about my story on about MRCP. So I don't have any idea about MRCP when I just completed my internship. So I was like thinking about what to do next, and I was completely confused whether to pursue my residency in India or abroad. I don't have any idea about it at that time. And then I joined a duty in a private hospital here in Tirunelveli, and then I felt the need. What's the actual need of the patients? That was the main thing which actually motivated me to study in abroad. So the main thing is it's a small story to begin with. So I faced a patient, and the patient's son has been admitted in the hospital, and the medical expenses was really huge, and the patient's father is just a taxi driver. I mean, I was keep on asking him, like, his salary was barely just 20,000. It was just barely 20,000. And I was like asking, okay, like, how do you manage your finances and stuff? And he was like, no matter what, I mean, at any cost, like, I need to save my son. That was the only intention of the father. And I was asking him, we are giving the same treatment as the government too. But what the expectation the father has was, I have preferred private than government just because like there may be some additional facilities which is available in the private which can help me save the sun. And I was like, oh my goodness. At that time, like we have given all the treatment available in the government, but it's the same. It's nothing unusual or nothing different. But still, the patients, if they come to us, they have a specific expectation. If I'm able to satisfy that expectation, I feel like okay, fine, I'm satisfied with my job. That's how I get a sense of satisfaction. If the patient is expecting something else, and if I'm delivering something else, then there is some disequilibrium, right? So I felt there is some gap in this, and then I was searching for what I can do. And then I felt that okay, if the patient is expecting something more than the government, then if I just train only in the government setting, I won't be able to provide a services which is, I mean, which is something unusual or something very important or something which is very new or evidence based. A lot of things. So that's when I chose the path of both MRCP as well as USMLE. And I was not sure about like whether to pursue only in the MRCP direction or USMLE direction at that time. And everyone said that like MRCP is the most toughest exam in the entire medical system. It's because the pass rate of the MRCP is really very low. There are 3 steps in MRCP. So one is MRCP part 1, the next is MRCP part 2, and the third part is MRCP PACES. Okay, so PACES is actually a practical exam. So MRCP part 1, it mainly consists of question based. It's MCQ based, and it mainly tests your basic sciences and stuff. And MRCP part 2, it deals with your clinical problem solving skills. And MRCP PACES is the most toughest and it's the most stressful exam which I have ever had in my entire life. So I have completed both USMLE as well as MRCP, but the most toughest exam was always the PACES exam. Even during the exam and even after the exam too, I was feeling like whenever I sleep, I just get up from the bed, got up from the bed, and was like blinking. Oh my god, I'm in the exam station. Even after completing the exam, I had the same feeling that I was still in the exam. That was my feeling at that time, and of course, the cost of the examination was not that much high uh, when compared to other exams like USMLE and PLAB. Okay, so before that, I want to say about few things about MRCP. So one thing is, I mean, to practice medicine in the UK, I mean internal medicine, there are 2 pathways mainly. So one is PLAB, and the next thing is MRCP. PLAB is somewhat a licensing examination. I think. So good evening, sir. I think Subramanian sir has just joined the meeting. Srija?
Yes, sir. Yes. Arvind has just now started the session. He's going on
Just
to
a
the
second.
Oh, okay, sir.
Can you hear me or just unmute me because I
Yes,
can't
sir.
see?
Sir,
Oh,
audible,
yeah.
sir.
Yeah, okay.
We are not able to see that video, sir.
See you all back again. Thank you, sir, and also Arvind. So they were both batchmates, both of them from year 1 onwards. So career pathways, that's what we were talking about this day. So I'm sure Arvind will guide you all. So all the best for Thiran program from TVMC and also the MSN State, Dr. Harihan sir and Jamuna madam. So just few points regarding career in UK as of now. So as he was just saying, I just joined 2 minutes ago. So PLAB is a licensing exam to get a registration like what we get from Tamil Nadu Medical Council or Indian Medical Council, whereas the MRCP is a diploma membership exam to qualify for a specialty. So it's like MD General Medicine here. It's a similarly like a 2 years program over there, or you can also do the exam nowadays in India. So which will be like a 18 to 2 years, 18 months, 2 years program. So nowadays there are some hospitals like Apollo, Aster MedCity, or from Pune also, they have this CMT training program. I've just joined as a faculty in BAPIO, which is the British Association of Physicians of Indian Origin. So they are spearheading this kind of CMT training program across different hospitals in India. So, I'm just been invited and joined as a faculty for that also. So, so PLAB is like your theory skills and also clinical skills. It's easy to pass, but also is it easy to fail because it's just a communication, how you do things, which is in your normal work environment, what you do as a house surgeon. So that's what is expected to be. But we have just show more empathy and also consideration and also convey the appropriate information. So like Ingela Vandu, you can just say to the patient, I'm the doctor, you listen to me. But that's not the case in UK. So you just have to convey the correct information appropriately to them. Just to give an example, somebody who has become unconscious and come or admitted in a hospital, and then they recovered. So without the patient's permission, you cannot say anything about this patient to the family member. So that is a valid legal point in UK. இங்க வந்து family member யார் கேட்டாலும் நம்ம எல்லா கதையும் சொல்றோம், but there you can't do. So that is the legal position there. So similarly, if a kid is above 16, they can take their own decision making, even if it is health or personal choice. இங்க வந்து நம்ம I think some people are still getting to know from the parents until they get married. So individual decision making is a lot more different in abroad. So that legality will also be taken into consideration when you take a health decision. So decision making in health is an important point in UK NHS. So that's about the PLAB and things. I think Arvind will guide you more on that. So with regards to the MRCP, it also has 3 parts, part 1, part 2, and the clinical, like MLE. And the PLAB probably will be changing the name as UK MLE rather than like US MLE. Is that correct, Arvind? So
It's
they
the UK
changed the
MLA.
name. Yeah, so it's not PLAB anymore. So, and Manchester is the office. So I used to work in Manchester with Ensha Hospital before. So with regards to MRCP UK, so that is, so you need at least 18 months of acute medical care for getting to do the final exam. You can do in any order, MRCP part 1 first, part 2 first, or clinicals. But you have to pass all of them to get the MRCP degree. MRCP is internationally valid degree. So it's also valid in government institutions and also in NMC. So we were in the first batch to get the NMC approve the MRCP UK here, and also now rheumatologists approved. So initially they were not in the approved list. So now you can also be a faculty under NMC once you finish MRCP. So that is equal to MD in India, like a DNB. DNB also similar to MD. So that's also from that point of view. But the MRCP final clinical exam is being conducted in different centers in India. So I do attend our exams twice a year, which we have guidance to do 2 times a year every year to keep up your competency and skills. So there you have something called portfolio, which is like a logbook, but it's online, so you can use all the important information, and there's a curriculum which will be mapped in the portfolio, and you have to satisfy the curriculum every year. So that is also as a requirement as a training period. So that's for MRCP. And from the job opportunity, I feel As of now, India has more job opportunity compared to Western countries. The only thing is, it's a competition is more, but you have to swim across wherever you are. So it's the same kind of competition. So in India, you are competing with other state people nationally. Whereas when you go abroad, you compete with other country people. So they generally call us Asians, Latin Americans or Africans, Europeans, something like that. So you compete with other Asian countries for any position, whichever country you are expected to go. So I think MRCP UK is valid all over the world, whereas PLAB or MLE is valid in UK and also in Australia, New Zealand, their own country. So that is for getting registration really. So that your medical degree and experience is valid and registered to practice in that particular country. So that's the position. So with that note, I wish this program, today's program, a great success, and get hold of Arvind before he flies back to US sometime next week, Arvind.
Sure, sir.
Okay. So all
Sure,
the
sir.
best and share your lights on them also. Okay. Thank you,
Sure,
Srija,
sir.
and thank you, Nandini.
Thank you, sir.
If you
Thank
have
you,
any,
Governor.
if you have any questions, you can quickly ask me, any of you. So when I was examining last time in Pondicherry a month ago, so the examiners from UK say the job market is a bit more tough nowadays. So what they are doing is they are increasing the base IELTS exam score so that they can reduce the competition. So that is one. And also, if you have a UK experience, they prefer the candidates. That is number two. So those who are directly coming into UK might struggle. And if you have an attachment there, it's better keep the attachment and keep going with different trust rather than coming back here. I know few people who have come back after few attachments and they can't get back to the country because the interviews will be short-lived and unless you are physically there. I know interviews also happening remotely, but then they might fill the post before the interview itself if there is a known local person. So, so if people are those who are in this group and who are looking for a career, so if you go there, try to hang on before. So you have to come back only after your first job. So that kind of approach should be there. Okay. So thank you everyone. Good luck.
Sir, there's a
Thank you,
question
sir.
in chat box.
Please,
So,
yeah, please, yeah.
how about MRCS? Is the NNC recognized? There's a question
Yes,
from
yeah,
Dr.
MRCP, MRCS both are recognized. Both are equal to MRCS, MRCOG, and MRCP. All are recognized under NMC. So you can be a senior registrar, assistant professor using that degree in any institution, any teaching institution. MRCM, somebody is asking MRCM. That I do not know because emergency medicine over there is different. So MRCM is more of acute care and system over there. It is different. So that I need to check up. Can we join medical colleges as a senior lecturer? Yes, after your MRC. There is a GU already for that. Any other questions? Promote till HOD, associate professor. Yes. Usually, what happens is if you are SR, then you become AP. 4 years after being in AP, if you have 2 publications in recognized journals, then you can promote as an associate. Then after that, 4 more years, if you have 2 publications, 1 publication, or if you have 2 publications in international, then it will be 2 years. After that, you can be promoted as professor. That is the NMC guidance. BAPIO 2+2. Which hospital are you looking for? Nazar, Nazar, somebody, Nazar. So I don't know other states, but as of now, Apollo Chennai is offering the BAPIO. I've just joined this faculty and I'm teaching end of the month next week with them. There are about 15 candidates every year. So altogether, nationally, around 32 candidates in that BAPIO training program, which is a CMT training program. I can answer whether it's good or not only next time. So few states not allowing MRCP in government sectors, that is, these people have to fight with the government really. So they are allowing MD and DNB only. So that's their own choice. So if NMC has approved, in which case you have to take the GO and fight with the Tamil Nadu Medical Council. I'm the first one to be registered my MRCP rheumatology nationally with the Tamil Nadu Medical Council. So I've taken some efforts with the council here. So normally what happens is the council should write to the UK GMC and they have to communicate with the medical council of the state that this is recognized from us. Then only they will take you into their regular registration, because there is an online portal. So you have to drop down. There is something called drop down box. In that, MRCP rheumatology wasn't there when I came back. So now it is there. So you have to put in some extra efforts. Thank you. I think that's close the chat box. We have 65 candidates. Arvind, it's up to you. Over to you. Thank you.
Sure, sir. I think Srija.
Thank you, Subramanian sir. I think the Hariharan sir also joined. So
yeah,
Hari.
Vanakkam.
Hari brother, good evening. Vanakkam, vanakkam. Nanna irukku. Carry on.
Thank you, sir. Thank you.
Thank you.
Sir, let them carry on.
Sir, you can can give us some tips on scopes of MRCP, as you are the MRCP examiner also.
Yeah. So I'm one of those beneficiaries of being an MRCP. So I mean, I do some teaching. I practice in a private setup. Sir, to answer the MRCEM, I think MRCEM is registrable in Tamil Nadu Medical Council as well, and it is recognized abroad in UK as well. So I think to work in acute care settings, it is there. So that's about MRCEM. So I will talk towards the end, I guess. So let Arvind continue his.
Okay, sir. Sure, sir. Thank you so much.
Okay.
Arvind, we can, sorry for the interruption, but we can go on with the session.
Sure. So, okay, let's start again. So, how I know about MRCP? That's a very big question everyone must ask, because soon after MBBS, MRCP is not a very usual pathway in Tamil Nadu. And mostly in India, very few candidates pursue MRCP after MBBS, and that not soon after MBBS. That's an unusual route. Like, I heard about MRCP on the very first lecture Dr. Subramanian sir gave in one of the MSN meetings. So he was talking about a rheumatological disorder and the marts, and at that time was astonished and amused by very long degree just behind the name, and he was like MRCP blah 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 blah, and I was like, oh, what are all these degrees, guys? Pretty confused. Oh my God, degrees! Then how come he has studied everything? And when I traveled with him in the car, like he was speaking about, okay, like we back in the UK did this and then did that, and at that time I was thinking about it, but I don't have any idea about that at that time. And only soon after my MBBS, I started this journey MRCP and USMLE both simultaneously. So while I was studying in MBBS, I had some idea about USMLE and I want to go in that direction, but MRCP is for my passion of internal medicine, and then it may even have. As a backup, I started just as a backup, and successfully I completed in just 10 months of preparation. So my timeline was like just in October 2023, I got my first passport, Indian passport, and then I applied for MRCP Part 1. I completed MRCP Part 1 in January 2024, and then USMLE Step 1 in March 2024, MRCP Part 2 in May 2024, and MRCP Part 3 PACES in October 2024, and USMLE Step 2 in September 2024, and that's my journey. So, and I also went to observership to the US for about 6 months, and then I just returned back from the US. And recently, I joined as a faculty in Pass the Paces along with Dr. Harigaran sir. And previously, 1 year before, I was a student in that academy as well. So, everyone will be having a question that whether after MBBS, is possible for an MBBS graduate to complete MRCP. So one thing is, I have already mentioned about three parts of MRCP: MRCP Part 1, Part 2, and PACES. So Part 1 is somewhat similar to basic clinical knowledge, and then Part 2 is about problem solving and clinical skills, and then Part 3 is mainly practical. So for Part 1 preparation, it's mostly MCQ. So if you can go through a lot of MCQs and if you can read a lot of books, the standard book is Kumar and Clark, and then there is another book called Step Up MRCP Step 1 and Step 2. So by Khalid Al Maghrabi, that's also a very good book. And there are two websites. So one is pastmedicine.com and another thing is fastest.com. There are a lot of questions available in that, so you can go through that. And the next is MRCP Part 2. MRCP Part 2 also has both the online coachings, online MCQ question banks. So one is MR Past Medicine and another. What else to say? And about PACES, there is an interesting coaching center called as Pass the PACES. It's a 4 day coaching center. It will cost about 1 lakh rupees, and then they will just train in all the possible cases, and you'll be finding a lot of findings which you can ever see in your entire life. That I can really assure you. So there is a possibility that we can complete MRCP PACES just with the qualification MBBS. So 12 months of internship is considered as a medical training. So after 12 months of internship, we can give MRCP Part 1 and months of medical training or job, whatever it is. And then you can apply for MRCP PACES of about 18 months of medicine experience. You can apply for MRCP PACES and you can attend the exam as well. So after 12 months of internship with your degree certificate, you can apply for MRCP Part 1. You can just prepare. The preparation hardly takes if it's rigorous preparation, we can complete it within just 3 months. And if it's gradual preparation, we need at least 6 months to complete MRCP Part 1. So MRCP Part 1, the pass rate is somewhat low. It's about 40%, and MRCP Part 2 is just 50%, and MRCP Part 3, that PACES, is again 50%. So there are two pathways for UK. So one is the PLAB route, and the thing is the MRCP route. So PLAB route is a licensing pathway. So just like a TNM's registration, we are licensed to work in the UK with PLAB route. And right now, the opportunities post PLAB is somewhat, the demand is somewhat very, very high, and the supply is very, very low. So there is some shortage after PLAB. But after MRCP, there are opportunities in the UK right now. So you can apply in both NHS jobs or track jobs. These are the websites available. And after completing your MRCP and getting GMs registered, you can apply to these websites to secure a job in the UK as well. So the MRCP degree is recognized worldwide except US and the Canada. And all all the countries. So that's one thing. So if someone is really passionate in internal medicine, though they do their MD or MD general medicine or DMB general medicine here, so a lot of candidates are showing interest towards MRCP as a boost to the knowledge, and it's like adding an own feather to the crown. So the next thing is what to choose, whether the PLAB route or the MRCP route. So just because of the demand supply mismatch, so right now the PLAB opportunities is somewhat very competitive. But on the other hand, MRCP side, the competition in the PLAB route is somewhat less, but still MRCP is competitive as well in terms of difficulty. That's the main thing. So PLAB is easy to pass and easy to fail, but MRCP is hard to pass and easy to fail. That's the main difference between PLAB and MRCP UK degree. And the next thing about MRCP is about the difficulty. Yes, of course, the exam is difficult, but I won't say that it's not a doable exam or something. That's definitely doable even for an MBBS graduate. So the main thing is you need to understand how the exam it actually works and what they actually need. This applies to any sort of examinations in any part of the country or whatever country it is. So the main thing is if they expect something, if you want to be, if you are in that level of expectation, then definitely you will ace the exam. So whether it may be NEET, USMLE, UKMLA, or MRCP, this still applies for each and everything. So and the next thing is, so for part one preparation, so just use the materials and 3 months of preparation. For part, so again, the 3 months of preparation is enough. And for PACES, you need to start from the beginning. You need to get familiarized to all those clinical findings, and you need to have a proper structured format and stuff. That's very, very important. And opportunities after MRCP, it's actually world recognized degree, so you still have a lot of opportunities. So when comparing to the PLAB route, so if someone with a PLAB is applying for the job, and if someone with an MRCP and applying for a job, they do give preference for MRCP graduates than PLAB route. So, and anything else? Like, do you want me to answer any questions about MRCP regarding the preparation, regarding anything? Hello? Do you want me to address anything in particular, specific? So the portions for USMLE and MRCP is some, I mean, medicine is similar in every aspect, but only the guidelines differ. So MRCP uses the standard NICE guidelines. So we need to be familiarized with that NICE guidelines. That's very, very important. So that's the main thing. So after PLAB, like you need to join as an SHO or for after MRCP there is an ST level jobs like ST1 or ST2. Or if it's a PLAB, you can join as an internal medicine training. And there are, as Dr. Subramanian sir said, there are a lot of hospitals providing the internal medicine training program and the CMT program. So where you can train some best hospitals like Apollo, Fortis, and stuff. So the best time to give MRCP. So I would say like whenever you feel like confident enough to crack the exam, like that's actually the best time to give MRCP. If you're very much passionate towards internal medicine and you feel that like you can be a tough fight, so definitely you can do that. And keep one thing in the mind. So if you're, I mean, the MRCP exam is not like if there are 100 questions, if you just crack about 70 or 80 questions, you will pass the exam. It doesn't work that way. So it works in the percentile manner. It depends upon whether you the pass or the fail. It depends upon the other candidates how they perform the exam as well. So even the marks, it depends upon that. If I'm doing good and if someone else is not doing good in that exam, then my marks will go high and his marks will come down. So it's somewhat and a percentile manner. So that's how the exam works. So your competitors will be post MDs, post DM, and internal medicine trainees, and those in UK as well. So you just need to prepare hard for the exam. So try to gain all the clinical acumen and stuff. So definitely you can crack it. If you work in clinic after graduation, is it considered as a clinical training? Yes, of course. Like you just need to have at least 18 months of experience in the medicine setting. So 12 months, I mean, internship is considered as a 12 months training, and then if you have about 6 months of additional training, then you can apply for PACES. So 12 months of clinical expertise in medicine is enough to apply for part 1 and part 2. First, you need to give part 1. After completing part 1, you can apply either for PACES or MRCP part 2. So first part 1 or next is part 2 or PACES, whatever it is. So you can complete PACES first and then part 2, but the recommended is like completing PACES after MRCP part 2 is a good thing.
Arvind, can I just intervene here?
So, yes, sir. Please,
Arvind?
sir.
Okay, yes. So I think
Yes, sir. Yes, sir.
the 18 months requirement will be in a hospital setting, because
yes, sir.
normally you will need a letter from the employer that he has worked and things, and also competencies will have to be signed off. All those stuff are there. So normally you need a hospital rather than a clinic work. Otherwise, people will be in a clinic for 1 year and then they consider as acute care, because it's acute care is required. So that's the crux of the MRCP exam, because many of the questions will be from acute care also. That is one.
Yes, sir.
Number two, with regards to CV, just 2 points I would like to highlight. You can Google through so many CVs, different things. There is one thing called commitment to the specialty. One of our trainees from Velamal, who has just joined as registrar in rheumatology just this August. So she has been showing the commitment since her UG days, like you guys, because you are attached to the MSN similarly. So for the newer people, what you should be doing is, if you want to do some specialty in UK, you have to show some commitment with regards to either a special posting for in radiology or something, case report publication, and also case presentation in different areas, and some work as audit with regards to a particular specialty. So you have to show some specialty, because when I was in the interview panel, you normally have to score the CV for that. So there is separate marks for commitment to the specialty. So there's a separate question. So if you don't have anything, then you don't get that mark. So that is called shortlisting. So initially the CV will be shortlisted before you come for the interview. So so that is an additional point. Okay, thank you. I'll let you carry on. Thank you.
Sure, sir. Sorry, the work in the clinic is not considered as a clinical training. It's better to work in the hospital. That's considered as the acute training. So as sir said. And about the CV part, like if you're applying for a job in the UK, like you need to definitely show some passion towards the field, whether it's cardiology or rheumatology or endocrinology. And there are two types of tiers. So tier 1 specialties and tier 2 specialties. Tier 1 specialties are somewhat competitive or highly competitive. So after MRCP, like if you can join a job in the department, like mostly the job opportunities are open towards acute medicine a lot than the specialty training jobs. So after joining the acute medicine jobs, you can just shift from that department to your department of choice, and you can train there for about 2 years or stuff, and then you need to develop your portfolios in that department, and then you can apply for specialty training. So the main thing is building the portfolios to join in the competitive departments. So that's how we can join in some competitive departments. So how much money would a student have to spend for this exam, sir? So for part 1, it costs about 60,000 rupees in Indian money. And for part 2, it's again 60,000 INR. And for PACES, it costs about 1,45,000. So that's the price. You can give all the 3 exams in India. I gave all the 3 exams in Chennai. So part 1 in Chennai, part 2 in Chennai, and part 3 PACES also in Chennai. So for the PACES exam, like there are 5 stations and there will be about 10 examiners, and out of 10 examiners, at least 3 to 5 examiners will be from the UK. So, and for the application, so pass medicine, it will cost about 4,500 for 6 months for part 1 and 4,500 for part 2. And for pass test, it costs about 20,000. So for part 1 is pass test is preferred than pass medicine. And for MRCP part 2, pass medicine is a good option. And for PACES, as I said, like there are a lot of opportunities. So one is Hospitals Academy. Another thing is Pass the PACES. I mean, I joined Pass the PACES last year. I was when I just entered into the session, I was like everyone was an introduction session, and everyone were introducing as an endocrinologist or non-oncologist and a professor, chief, and associate and stuff. But I was like, I'm just a duty medical officer in a private hospital. That was my intro at that time, and I was really panicked at the time. And at that time, Dr. Harigan sir really helped me a lot, and he really motivated me. You have just completed MBBS, don't worry about it. You just try to learn and stuff, and that was really motivating for me at that time. So, of course, you will face a lot of problems in this journey after if you are doing a post MBBS. Like a lot of persons will discourage you, and the marks and stuff, and the competition you have, and about the past date, everything will be definitely distressing. Even I have faced a similar sort of problems. So everyone will say MRCP is a post MD exam. So post MD graduates will be competing with you. So whether you're able to crack MRCP or not, it's a great question. Everyone was speaking like that. I was like really confused and was frustrated at that time. I mean, I have a lot of my non-medical friends and they don't know about it, and they just encourage me like, okay, Arvind, like you can do anything in this world and stuff. That really kept me going. So, and a special thanks to them as well. So any observationship needed in the UK for us to be selected in? Okay. So post MRCP, like you can apply for clinical attachments. So even if you don't have any clinical attachments, like one of my friend, like she actually completed MD General Medicine in India, and then she joined as an assistant professor in SRM University, and then like she applied for MRCP PACES. She completed all the steps, and she's my very good study partner too. So she actually went to UK, so without any observation and stuff. But she has a lot of clinical expertise in India. So if you have an observership in the UK, so or a clinical attachment, that would be really helpful in securing a job in the UK. So for research and publication, like for my juniors, I would like to recommend please start on working on at least a case reports. So case reports are the easy thing, which is similar to just a case sheet and stuff. So just be on track. If you're not able to run, you just at least walk. If you're not able to walk, you just crawl at least. So initially, like to start with, you can just start with a clinical report, and then you can go for some experimental case. I mean, some observational studies and stuff like cross section study and stuff, and then you can go for a cohort study or a case control study. That will be somewhat easy. So to begin with, you can start with case reports and then a case series. Or else, like if you face any sort of problems, like if you're not able to give enough time and stuff, if you can involve a group of people by doing a systematic review or meta-analysis, that's really high in the evidence table. So definitely you can do. So for my juniors, like if you can join as a group of about 10 or 5 members, so if you can work in just one paper, you can do a systematic review or meta-analysis. And I have also made a proposal and suggestion to Srija regarding that. So if you want, like you can also do something like that. So that's one thing. And the next thing is more than the clinical research and stuff, if you can do a quality study, quality control study, like a clinical audit, that will be somewhat more beneficial than research. So because NHS, it mainly concentrate on the quality than the quantity. So if we can do a quality clinical audit, for example, I did a clinical audit on a diabetic screening, diabetic complication screening. So I have taken a lot of diabetic patients and or under regular screening for the complications and whether they are under proper screening or not. And I have figured out a way out, okay, what's the reason behind this? Why the patient is not coming for a complication screening and stuff. And I just educated them and stuff. And then finally, like I made an audit. So you don't need to publish an audit and stuff. You can just present an audit in your hospital setting and stuff. That will be really helpful. And you just document it in a copy of in a paper, and you just store it with you. So case reports, meta-analysis and systematic review, and clinical audits can definitely be helpful. So even if you don't do in a peer-reviewed journals, like try to do, that's really recommended. You can do a clinical audit. What are the various benefits I can have on giving MRCP in India and other countries like Australia? So after MRCP in India, like you can work as you can work in medical colleges and you can also work in private hospital settings in here. And recently they have also said that like you can even work in the government too. And post MRCP, like if you are doing USMLE too, there is an option where the residency training in the US can be reduced from 3 to 2. Some residency programs, they do accept MRCP and they just convert the residency training from 3 years to 2 years. That's possible. And post MRCP, like after having some clinical audits, after having some research, if you can build a strong portfolio in your specific field of interest, then you can go and join the specialty training, and then you can train for about 3 years or 4 years. Based upon the specialties, and you can become a consultant in the UK. And of course, like MRCP is recognized in Australia too. So there are a lot of websites and agencies where you can apply to with your degree, with your clinical expertise. But most of the times, like all the persons will be having a bond for about at least 2 years. And there are massive opportunities after MRCP in Singapore. Even I got an opportunity in Singapore too, but they have asked for a bond of 2 years. So the bond is the main issue. Like if you're okay to go abroad and work abroad, and if you have a definitive plan of going to this place, then that's fine. You can absolutely go there. Because I have an idea to move to the US for my residency because I don't have a proper residency. So I really want to study internal medicine again, even after MRCP, to boost my clinical acumen.
Arvind, just one more point.
Yes,
For
sir.
the people who are still before CRMI, so the logbook is very important. If you are coming to work in UK, so the logbook will also help you because you need a reference. Two people, we need reference from India. So those who are, I think CRMI period, you get hold of a good person who can give you good reference. And also logbook should be documented. That is important over there. And also, if you are looking for like a pediatrics or OG or something, in your CRMI period itself, you can show some extra interest and try to have case presentation or come to a state conference where you can present a poster or a paper. So every specialty, if you want to do a pediatrics, you all will have some specialty posting during a CRMI. So that period you can utilize and also get some documentation like a certificate from your concern. Every specialty you should have a supervisor. That's in UK, but here also you will have a completion certificate from the HOD. So get them attested that you have submitted or posted or presented this paper or poster. So that will also be helpful because all documentation and records are required. So you can't come back. I remember after going there, they are asking some evidence from the college, but then nobody answers. If you are abroad and ringing through here, and you can't get somebody else to do for you. So my dad helped at the time, but nowadays it's all issues beyond that. So you have to come personally. So try to complete all those documentation paperwork and CRMI experience certificate, something like that, before you move abroad. So that is important in terms of CV. And Doc, I think from the research and things point of view, so there is a separate, I think, program, but there is ethics committee which has to be approved, and only you can go for publication. Nowadays, anything you cannot publish unless you have ethics committee approval. So that is a major change in the last 5 to 10 years. So even case reports, you have to have some ethics committee recommendation, or at least patient's consent that you can present this. So that is important. If you want to present a case, you have to get the consent while the patient is with you, get their approval, whichever journal you want to submit, and then write up for the journal. So that is important, because these things you can't do when the patient discharged. So there's no way you can get back to them, kind of. Okay, so that's 2 more points. Thank you, Arvind. Sorry about that.
It's okay, sir. So they much focus on PubMed indexing first authors. So recently, like I attended a conference where there were a lot of program directors. They were interviewing a lot of candidates, and they said that there are a lot of paid agencies for PubMed indexing and stuff. So I don't recommend that. That's one thing. And then the next thing is, like, if you're working as a team of about 5 members, you must definitely know about it. If you're just paying someone for PubMed indexing and stuff, that's not going to work at all. So it's more about like what you do and how you do than where you do. That's very, very important. So whether it's India or in the UK, that doesn't matter. How you do and what you do is very, very important. So even if it's a PubMed Index journal or a Google Scholar or Web of Science or whatever Scopus or whatever it is, like if it's a very high quality journal, then that's fine. Of course, PubMed indexing and the journal impact factor is given a lot of preference, but still uh, that's somewhat fine. So, but don't go for PubMed indexing just by giving money to some persons and stuff. That's not recommended at all. So which pathway is better in terms of job opportunity and exam difficulty? PLAB or USMLE, MRCP? Okay, fine. So when compared to PLAB and USMLE, PLAB is somewhat easy than USMLE. That's for sure true. On the next thing is USMLE is somewhat difficult, and it brings a lot of money. I mean, it brings a lot of capitation too. On the other hand, PLAB, it also brings a lot of capitation, but not as similar to USMLE. The difficulty level of USMLE is somewhat difficult. It will take at least about 2 years for the entire process, or at least 1 year, and you will face a lot of struggles like visa and stuff too. But still, it is doable as well. I completed USMLE step 1, step 2, and step 3 too, simultaneously with my MRCP too. And I also went for observership for 6 months and just returned back there, and I applied for the match. And I'm currently doing my interviews. So opportunities after USMLE, definitely you can join into a residency. The competition is such a way that yes, it is very difficult. But if you complete all the steps like step 1, step 2, and step 3, and do a lot of your observerships and have a lot of publications to your name, then definitely you will get the residency seat. That's for sure. So the stats show that like out of 2 persons, out of 3 persons, 2 candidates will definitely secure a seat. 60 to 70% match rate is there in USMLE. But in the contrast to PLAB, right now the post PLAB the opportunities are somewhat is really low. So the waiting time, I mean, is more than about 1.5 years at least. So while doing a PLAB route, like if someone is doing an MRCP route, then you're able to complete MRCP, then you still have a lot of opportunities in the UK. You can just begin your career as a medical trainee too. That's not an option. That's an option too. ST1, ST2, ST3, ST4, and ST5. That's it. Any other questions? Hello.
Yeah. So I think Arvind, thank you, Arvind. I think you were there. Uh, um, uh, I think MRCP is one of the ways to go when you have a NEET PG that is very, very crowded here. And MRCP is for people who have passion towards internal medicine and probably go um, forward from there. Uh, I think it's great that you have finished MRCP at a very young age, and I congratulate you on that. And then
Yes, sir.
probably I think that many people can take the lead from here. And MRCP is not only a degree for going to UK, I guess. MRCP is well recognized degree across the globe, and most countries recognize MRCP as one of those degrees that is there. So MRCP is done for various reasons. One is to improve your knowledge, get a degree. Two is to have a job opportunity. Three is, I mean, people who undergo MRCP as a training definitely will feel even after their MD that they have changed a little bit from their kind of practice, the way they conduct their patients, the way they explain things to their patients. So I think that is also something that MRCP will teach you. And I think Subramaniam sir is one of those great teachers of medicine and someone who can guide people into the MRCP group. And I think it's great going. And thank you, Srija, for putting this up today.
Thank you, sir. Srija ma'am has a connectivity issue. Thank you so much, sir, for your kind words.
Thank you, Nandini. Thank you, Nandini.
So actually, for me, like I have learned a lot of things from MRCP. So MRCP, it actually teaches more than it is. That's a standard punch for MRCP. So when I was doing when I was a student in the past AP session, like I was presenting a case to Dr. Harigaran sir, and at that time, it was just a case of osteoarthritis. Because I am fresh from MBBS, I just did a patellar tap test, and then I just checked for crepitus and stuff, and I was pretty sure it's a clear-cut case of osteoarthritis, and I just presented it as okay, fine, sir, it's a case of osteoarthritis, and Harigaran sir was like, okay, then I was completely confused at that time, and then he was like, okay, fine, if it's a case of osteoarthritis, check the BMI of the patient. If he is obese, try to find out what's the reason for obesity, whether if it's a simple obesity or is there any association with the metabolic syndrome or an endocrine cause or a psychological cause or whatever it is, and how it affects the patient's life and how it creates an impact in his daily life and stuff. So everything must be connected. And then he connected just a case of osteoarthritis, obesity, and then metabolic syndrome, and then up to the level of obstructive sleep apnea. I have never ever thought about it. So what's the relation of just I mean uh, asking about a sleep history in just an osteoarthritis patient? Okay, if a sleep is disturbed in an osteoarthritis patient, we need to think up to the level of obstructive sleep apnea. That's somewhat quite interesting and different. That was that must be really very very new for an MBBS graduate at that time. I was not able to think about that, and sir actually taught me that. Sir, do you
That
remember
is,
that, sir?
that is internal medicine for you, guy. That's internal medicine. I think we should do it for every patient. I think we should sit and look at the patient as a whole. That's what MRCP training
That's
will
very
teach.
true. That's very true. And I was really gifted to have a great teacher like you, sir. At that
Thank you.
time, I was completely in a panic situation, and I felt like, sir, I feel like I'll definitely fail in this exam. And he gave me some motivation and stuff, and then he showed me like how
Yeah.
I actually need
And
to face that exam. And thank you so much for that, sir.
thank you.
So I think we have few questions too. So is it possible to become a surgeon in UK or US? So I think for UK, like Sir would be a better person to answer that question. And for the US, there is still a possibility you can become a surgeon. The main thing is the portfolios, and the portfolios. So if you have a strong, if you're having any interest in towards a specialty, to say that you have an interest, you need to show something. So how do you say that like you have an interest towards that facility, towards that specialty? So you must show that like you have worked in a surgical specialty, you have worked in the surgical hospitals, you have assisted a lot of surgeries, and then you have presented a case presentations and you have attended various conferences in surgery and stuff. So just show some passion towards a field, then you can definitely, it is possible. So, and I have a lot of my friends who is preparing for USMLE and for trying to become a surgeons and obstetrician too. So what can be done during UG period to pursue USMLE and MRCP post internship? So how to get observership in the US? How to get observership in the US? We can deal that in a separate session. Let's make this session only for MRCP. So what can be done during UG period to pursue? So for MRCP wise, the main thing is you need to learn medicine. That's one and the only thing which you can do. So try to use standard books. And I see a lot of my juniors using just Marrow for their exam. So I would recommend you to use at least Davidson or Kumar and Clark. Kumar and Clark is the gold standard for MRCP. Any other questions? So the main thing is the association, which I have previously told you about that. You must be able to link whatever the physical, mental, and social, the emotional well-being of an individual as a whole. We just deal only with the health, physical well-being. We don't deal with the emotional, social, and the all the stuffs. All the pillars must be addressed in while handling a patient. That's the main thing you need to learn in the MRCP. Any other questions?
I think we have another question. What about MRCS, and does whatever you told about MRCP apply for that too?
For
So
MRCS, you
have
need to definitely have surgical training. You need to join surgical training, maybe at least MS general surgery. Only after your first year of surgical residency, you can pursue MRCS. That applies for psychiatry and dermatology too. For MRCP, for MRCP CH, that's for pediatrics, for child health. So it's similar to MRCP as well. So where you need to have 12 months of clinical training and then additional 6 months of clinical training in a pediatric setting. The hospital, that's fine for MRCCH. Any other question? And I of course recommend everyone to volunteer in something and show some volunteering. That's very good in your portfolios. So volunteering, some speaking work, and then some presentation, attending conferences, and presenting papers and publishing and doing clinical audits. That will definitely improve your portfolios, and you can do that. Even doing seminars in your colleges too.
Yeah, I also remember other than doing, we used to do camps, health camps, along with IMA Tirunelveli, and we were part of MSN that time, and we used to do sports. Yeah, we did a very well that sports camp. We organized one in a children's home. So we also used to do health awareness sessions. So that was a great period, and that was a good volunteering also. So with
A
MSN and
small
IMA,
correction, it's not just one. A
yeah,
small
yeah.
correction, it's not just one. It's actually 4 or 5.
Yeah, exactly. Yeah, we did, I think so, five. Yeah, we did. So yeah, you put lot of efforts to that, and the papers. Yeah, from the internship itself, you were focused on doing papers and publications, and before that itself, you finished this volunteering and all with the 5 camps, and you used to attend the other camps too. So yeah, I know that. I wanted to add that with IMA and MSN, we are doing camps and in Tirunelveli, and in every part we have IMA. In every district, we are having MSN. So you can win association with, we can volunteer and do events. So I wanted to mention that.
Actually, definitely IMA MSN Tirunelveli will help you in building your portfolios. And having a very good leader like Srija, definitely like she will rock. Three steps, what additional
Thanks,
qualities
Yaris. I think
to secure a job, just
okay.
in case.
We have another question. Say, if I passed MRCP 3 steps, what additional qualities needed for me to secure a job or specialty program like cardiology? And is there any equivalent for general medicine in UK like we usually do in India?
The next thing is like after MRCP phases, after completing 3 steps, like if you want to join in cardiology, cardiology is a tier 1 specialty which is highly competitive there. So to become a cardiologist in UK, after doing MRCP, I would recommend to do, to have some training or you have some experience in that field as a registrar or as a training and stuff. So if you have about a non-training jobs are available in cardiology specialties, if first initially you need to be a non-training, you need to join a job, like you can join into a training job. That's possible. So to match into a highly competitive specialty, like we need to have some additional qualities. So like presenting a lot of papers, having a good quality research in impact journals, and that's very, very important. And you must also have some experience in that field. For example, if it's cardiology, completing 3 months of 3 years of MRC, sorry, 3 steps of MRCP, 2 months of non-training job in cardiology as a registrar, and having a lot of research and stuff, definitely it can help you secure a specialty program like cardiology.
Okay, I think we have answered all the questions. If anyone else have any questions, we can proceed or else, yeah, it's about time.
Yeah. Okay. Thank you so much
Arvind,
for the opportunity.
Srija, one more observation.
Yes, sir, we can. Yes, sir.
Okay, so now I know one house surgeon from Velamal. What she did was, like Arvind, she was too early into the USMLE. So she got a 6 months permission from the university to go to US for observership. And then came back to complete the CRMI here. And now she's probably gone over there. So that also you can do. Our university also supports that. So there will be delay in your CRMI completion, but then if you got a position, then you can utilize that. So that is also an option there. So she did her exams well before her CRMI period. Like I think you, Arvind, you have been there for 6 months now, right?
Yes, sir. Yes, sir. Yes,
So
sir.
this is after a house agency, but that was during her house agency itself, she went over.
Even I was trying for the same, sir, but
Yeah.
in our college, like as it's a government college, like they don't
Yeah,
allow
that's right.
accept. That's the main.
So you have to have some extra support from the institution, and also the university will grant it. So there will be delay in your registration, but that's okay. As long as you made up your mind, definitely you are going abroad, then there shouldn't be a problem. So that is also an observation I just came to know. So that's for you.
if anyone is searching for US clinical observerships or stuff, like we can just create a group for our juniors, and then there is still a group right now. So if you can join in that, I can connect with you with some physicians who can provide observerships too.
Yes. I think that will come only when you are. Have you done the CSA or still yet, Arvind? Part 3.
For USMLE, sir?
Yes.
Yes, sir. I have completed, sir. There are just 3 parts in USMLE. USMLE
Yes.
step 1, USMLE step 2 CK, and step 3, sir. So step 2 CS has been scrapped recently after COVID. Post COVID, there is no step 3. I mean, step 2 CS, sir. And instead of step 2 CS, we have OET exams. So to get GMs registered, as we need MRCP Part 1, Part 2, and PACES and OET exams. Similarly, we also need OET exam for PCF from the certification too. For these.
Yes. Okay. Okay, it's a good interaction, and thank you everyone. So thanks Rija also and Arvind. It's a fantastic interactive discussion. Thank you, Hariharan sir. I'm leaving by now. Thank you.
Thank you so much, sir. Thank you so much, sir.
Thank you, Subramanian sir. Thank you for guiding us. Okay. So I think the questions are. I think we answered all the questions, and there was a question of how, yeah, during UG period of MBBS to pursue MRCP, that I think Subramanian sir answered for that. You can prepare in USMLE, you can prepare the USMLE steps, and you can, if your university or your college is providing you the chance of going for the observership and coming back and completing the internship, you can do it and go for it, because everyone after the MBBS, they'll go for NEET PG, or they'll start from the step 1 of USMLE. If it is possible for you to with USMLE steps in the beginning, and you can start with that in the when you are studying MBBS, and then go for observership in prior to your internship, and then you'll have a definite a job opportunity in hands if you do in this way. So if it is possible for the medical students to do this, then you can proceed, I guess. So
Actually,
I think
here.
Is there any? Yeah.
So actually, I know MD internal medicine is very competitive in India. So not all of us get an opportunity to pursue MD internal medicine, right? So I have seen a few of my friends and batchmates too, who are really passionate in internal medicine, but due to some circumstances, they just change the field and change their mind too. For them, this is actually a very good opportunity. One of my study partners, she's actually a chief in pediatrics in Sri Balaji Medical College, and she's about more than 45 years of age. She actually cracked MRCP Part 1 and Part 2 and PACES along with me. And another
I think that's a break. There was a break.
MRCP completely.
I think it was not audible after the chief part. I think so.
Oh, I'm so sorry. I'm so sorry. So what happened was like one of my study partners. I have 2 study partners. I mean, I need to mention them. So one is a chief in pediatric chief in Sri Balaji Medical College. She was actually very much passionate in internal medicine, but due to some family circumstances, she has to join her pediatrics residency. And many years after her pediatrics residency, like she just completed the MRCP PACES to become a physician. And another study partner, he's actually 78 years old and he's a retired professor in AIMS Nagpur. He is also my study partner. He actually completed MRCP just now for his passion towards internal medicine. I was like, oh wow, what the hell, man? 78 years and MRCP, what are you gonna do with that? And he was like, it's my passion, yeah. I'm really amazed by that. Yeah, you don't get a seat in internal medicine. So we can use that as an opportunity.
What about the general practitioners?
Thank
They
you.
are with just so what about the general practitioners? If they are with only MBBS and the state and MRCP, they can pursue.
Yes, even
It
general
adds to
practitioners do
their
MRCP. Even general practitioners can pursue MRCP too. So that's a very good option for them. So I have just seen this only one candidate. Actually, he's from the Arunachal Pradesh, I guess. So he actually soon after MBBS, like he joined into general practice because no such hospitals were there in his hometown. He completed MRCP and then he just became a physician, consultant physician there in his own hometown. Yeah. Any other questions, Rija?
I think in the chat, I think you answered all the questions from the chat box. And if anyone wants to ask any question, we'll give a minute for them. Okay, I think so. We can proceed with. So thank you, Arvind. Actually, invite that accepting our invite and coming back to the OG of MSN Tirunelveli. And it's very grateful to have you, and thank you for enlightening us on MRCP UK, and I hope many have gained more knowledge about it. And yeah, that's not proceed with the vote of thanks.
Yes, ma'am. A very good evening to all. On behalf of IMA JDN and MSN, I take immense pleasure in delivering the vote of thanks for Thiran Session 2. First and foremost, I extend our heartfelt gratitude to Dr. M. Aravind for taking time out of his schedule to guide us through the MRCP pathway. Your insights on the preparation and opportunities were truly insightful. Thank you, sir. I extend our gratitude to our IMA JDN Tamil Nadu Chairman, Dr. Hariharan sir, and our former IMA Tirunelveli President, Dr. Subramanian sir, for joining us on this event. Thank you, sir. A big thank you for our MSN team and JDN team for organizing this event and making it a huge success. And thank you for the audience for joining us. Thank you, everyone. And good night.
Thank you, Arvind. And to announce, we'll be having our third session of Thiran soon. So we'll be having session on UPSC CMS. So hope that will also be a valuable session soon after this. So join us on next Wednesday for UPSC CMS too. Thank you, Team MSN Tirunelveli, and thank you, JDN also. Thank you. Thank you, guys.
Thank you, ma'am.
Thank you, Classmate. I think we can finish the meeting.
Yes, thank you so much, everyone, for joining this session. Clanet is really glad to have all these brilliant people together. So, with all your permission, I'm closing the session for today and looking forward to hosting you again. Thank you so much, everyone. Have a good night.
Thank you, Darshan and Joel. Thank you.
Thank you, ma'am.